Hello, sisters. Welcome to the Sacred Medicine Podcast, weaving powerful, soulful practices into functional medicine. Step into this beautiful space of devotion and explore everything from nurturing foods, rituals, sexuality, and awakening your innate sensuality. It is time to own your radiance. This is the Sacred Medicine Podcast. Hello and welcome back to another week of the Sacred Medicine Podcast. I am your host, Margaret Romero, and this week we have Dr. Stephen Lin. He is a world-leading functional dentist, TEDx speaker, and author of the international #1 Amazon best-selling book, The Dental Diet. As a passionate preventative whole health advocate, Dr. Lin focuses on the understanding of dental disease through nutritional principles. His work has highlighted that crooked teeth and the orthodontia epidemic are diet-based problems and the need for public health policy to prevent braces in the next generation of children. So this was it was such an amazing conversation because we talk about things that I bet the majority of people who are listening right now have experienced. One being teeth extractions. So for those of you listening, I'm sure you've had some teeth extracted, you had some braces put on, and this can lead to a lot of things in your adulthood. A lot of problems with insomnia, and we talk about so many other things. And we also talk about how, what to do now. If you did, when you were a kid, you had like 4, 6, or even 8 teeth extracted, and what to do now if you're having certain signs and symptoms that may be correlated with that and how to sort of correct that. So we talk about that. We also talk about, also how it's also leading to some sinus issues and sinus problems that we're commonly seeing now. And we talk about diet, the best diet that's going to help promote teeth health, as well as the best supplements to be taking to promote healthy gums and teeth. So you really want to listen in because we've got so much good information here. So you'll know what to do with your teeth, and also to find out if you do suffer from like gum disease, frequent cavities, that the reason behind that and why that's happening and how to correct it naturally. So on to the show. This week, my guest is Dr. Stephen Lin. We are talking all about his new book, The Dental Diet. Welcome to the show. Thank you so much for being here.
Hey, Margaret, it's a pleasure. Thank you so much for having me.
Yeah, so there's so much good stuff in your book. Everyone you guys need to go out and get this book because there's so much in here that I never knew about. I mean, there were definitely things that I know about being in functional medicine, but the stuff that you touched upon in your book were so eye-opening. And so one of the things you talk about, and maybe we can start here, is the rise, or maybe there's not a rise, but it is just this ongoing thing of orthodontics and kids having, extractions, braces, and what the lasting effects of that could be on their health as they age. So can we start with that?
Yeah, absolutely. And, I'm so glad that was a point that really kind of resonated with you. And especially considering, Margaret, that you're in functional medicine, it's such an exciting area because really, we've had this whole space of functional dentistry just kind of being a little bit hidden. And so it all kind of comes back to, how our faces, how our craniofacial systems, how our jaws grow. And, we kind of, for instance, take our children, or we were taken to the dentists and orthodontists, and the general kind of way that we approach malocclusion, as we refer to it in dental health professionals will call it, or crooked teeth, is that we classify it and we we'll basically treat it. And so treatment is often, between when a kid is 10 to 13, they'll have braces or they'll have extractions to move the teeth into place. But that doesn't really get to the core problem as to why the teeth are crooked in the first place. And so this is the big issue here, is that today I don't see any kids that grow a jaw that fits 32 teeth. And that should be one of the most alarming, health statistics on the planet. And if you look at kids today, and you look at the amount that are having braces, but then we also look at, in young adolescents when they have their wisdom teeth out, this is the same problem. It's our jaws aren't growing. That's why teeth don't fit into mouths, and why, we need to straighten teeth now. And so there's been a whole area of what I call functional dentistry moving forward to kind of understand why this is happening. And a big part of that, and what we explore in the dental diet, my book, is, why that happened. And it's nutritional. There is a clear demarcation between when anthropologically we began to eat the modern diet and when malocclusion or crooked teeth pops up. So, and, any anthropologist that you talk to will confirm this. And the skulls that they look at, beyond the industrial and certainly beyond the agricultural revolution, they don't have any dental diseases at all. And, that's really a way that we've kind of, we've classified dental disease as something that we just go and fix, but it really is a marker of something much, much deeper going on in the body. When your jaws don't grow, your airways don't develop, and the problems that we see now are just so common. And so that's breathing, sleep disorders, things like teeth grind, digestive disorders. They are all part of this spectrum of people that haven't developed craniofacially and had crooked teeth as a result.
And so tell us about the sleep disorders. I mean, there's so many patients that come in to see me have insomnia, and they have for many, many, many years, or they've been children that just have never been able to sleep. And so, is there anything that could be done about this? I mean, if you find out, well, I had, 6 or 8 teeth extracted when I was a kid, I mean, there's nothing you can do about that. So how does it, how can one correct if they do have, insomnia, let's say, for example?
Yeah, it's a very common, the stats say somewhere around 70 million Americans have sleep disorders now. And you're exactly right. Nearly everyone is suffering from symptom or two from these kind of syndromes. And, insomnia is a very broad term, isn't it? It's like, and, it really is, a matter of kind of digging deeper into, why this is happening. And often it's a problem with breathing. And so the way, that functional dentistry is kind of modeled now to approach this problem is that we see that the airways are dysfunctioning. And so there's very easy oral signs that we can see to check how breathing is, how a person is breathing through the day, and that will reflect on their nighttime breathing. And so, for instance, teeth grinding and bruxism is often a sign that a person is pushing their jaw forward to open the airways. And this is a sign the brain is getting a signal for increased pressure in the airways, and it's pushing a sympathetic choking signal when they're sleeping. And that will come up as a respiratory effort arousal. And so what happens then is that a person won't wake up, but they'll actually, their brain is sent in this survival mode. So often people are going to sleep and they're not reaching deep REM sleep patterns. And so even if you do sleep, you're waking up and you're not feeling refreshed. And then other times people won't be able to sleep at all. And it's all a cycle of this whole autonomic nervous system going wrong, because when you go to sleep, your brain is going through deep neurological rest periods. And if you don't have, the kind of architectural and breathing rhythm in place, a lot of things go wrong. And so that's why people present a long way down the track with things like insomnia, obstructive sleep apnea. Even in kids, we see snoring, teeth grinding. If any parents see that, they should be immediately very, very concerned, because this is, the fundamental development periods their child is going through, where their brain is developing when they're sleeping. So we need to be able to see that.
And so is there any sort of manual manipulation of cranial and facial muscles and whatnot to kind of help things along, or are they just faced with a lifetime of this now?
Yeah, the first thing we need to do is kind of see where the dysfunction is. So a quick oral exam, that any functional medicine practitioner, really can do. And so a quick check with these people is that they often have tongue dysfunction, so they won't be posturing their tongue very well. And so that can often come alongside a tongue tie or ankyloglossia, which is a flap of skin under the tongue. And so even in adults, we should be checking for this, because we can release them now. And it can help to get their tongue to the roof of the mouth. Now, you might ask why that's important. Well, that's basically designed where your tongue should be. Your tongue is this amazing organ that sits and connects to the base of your skull, the hyoid bone, your jawbone. And so when that's not postured properly, you actually don't hold your airways open. And so that's the first thing that exercise-wise people can do to start to reprogram their dental and craniofacial structures to breathe properly, start using their tongue properly. And this is an arm of functional dentistry called myofunctional therapy, where we teach a person to breathe through their nose again, and there may be nasal obstruction issues. We teach them to be closed lip right throughout the night, and we teach their tongue to be at the roof of the mouth. Now, some people who have high palates and kind of narrow V-shaped roof of the mouths, they might need dental expansion. So we can do that even in adults, and certainly in children, where we expand their palate out. And, it's a simple night guard that we wear for about 3 to 6 months, maybe a bit longer. That can help get some space in the mouth for the tongue to sit up to that palate. And so just by getting that, working towards that, that functional postural homeostasis, we can really help someone to breathe better and also sleep better as well. So these are things that we have to be doing when we're sleeping.
Okay. Now, speaking of palatal expansion, I, as a kid, as a teen, had maybe like one or two teeth that were a little off, and they wanted to extract 4 teeth, and I didn't really want that. So they put in a palatal expansion appliance, and I used that for, I can't remember, maybe 3 or 6 months. And then those 2 teeth went in pretty easily. Now, is that the same type of palatal expansion you're talking about?
Yeah, it's similar. There are some different ways to do that. Yeah, and that's actually great that you did that, because often, especially people that have had teeth extracted, by definition, you lose airway space. So you actually saved some of your airway, and probably prevented a host of potentially more serious sleep issues later in your life from extending that out. Yeah, so it's similar. So there are different ways to do it. So you can expand just in one direction, which is kind of the side on horizontal axis, or there are some expanders that will expand in 3 dimensions, that also forward, because a lot of people need to grow their upper jaw forward as well. And that, because the one problem we say with a lot of our faces now is that we're all set a bit back. So if you kind of think of your profile, if you look at your profile or your child's profile in the mirror, and you look at their chin and you look at their cheekbones, it should all be kind of in a straight line. And so or the chin should be only slightly behind, the line of the nose. But if you look at many people, their chins are set back, and even that, they don't really have cheekbones. So for those people, especially in adulthood, there's, a finite amount of expansion we can do, but it still can reprogram them to feel a lot better and help to kind of get these deep neurological systems back, functioning in a way that's much more restful for them at night.
And by the way, I sleep like a baby. I mean, have never had an issue sleeping. I go into REM a lot. I've never had a problem. At the 30 seconds, and I think by the time my head hits the pillow, I'm out. If that has any correlation to my palatal expansion experience. So,
well, yeah. So if you look at your patients, for instance, that have these insomnia issues, look at their palate, and you can even measure their intermolar width, which is their first molar at the back of the mouth. Most of them will probably be less than 35 millimeters, but that you'll just by observation, you'll see they'll have high palates, like kind of, and you can kind of look at yourself in the mirror if you're listening, and kind of check your palate. If you see that you've got a palate looks high, it's difficult to reach up and touch. By definition, that's taking airway space, and so when we expand that palate, which is your maxilla bone, we expand out and we gain volume in the airways as well. And we can remodel this even into adulthood. It's quite remarkable.
Cool. And so is this also affecting people's sinuses, sinus issues, sinus problems?
Absolutely. I mean, those airways, the nasal airways, are sitting in the same bone that your teeth are. So your upper teeth, your upper smile, the way that is arranged, if you have a crooked upper smile, it didn't fit, that is using the space of your upper jawbone, which uses the space of your nasal and maxillary sinuses. So people with sinus issues will, it's usually an underlying breathing problem. And so we need to kind of do a joint oral, dental, and functional breathing assessment to see, and sometimes this will involve an ENT surgeon to check if we have deviated septums or other issues in the nose. But it's all the same thing. It's sitting in the same bone.
Right.
So it's really important we see that, yeah.
Okay. And so correction of this is possible, and then hopefully relief of insomnia, sinus issues, breathing problems, things like that.
Yeah, so these are the real functional issues. Architectural issues of the airway. I find often, and this is what my book goes into as well, is that there's often deficiencies. So vitamin D deficiency, important, vitamin K2. We often have gut issues with people with sleep problems, and so making sure that we get that physical and airway working properly, but then starting to get the nutrients and microbiome balance so that we can get the whole system working as it should.
Yes, I think that K2 is such an important supplement, by far, and I think it's something that a lot of people they currently don't take or don't have that as part of their repertoire. With their D. I know that D comes with K2, but not in all supplements. Can you talk about the importance of K2 a little bit?
Yeah, K2, vitamin K2. So for what I was conventionally taught, and medical practitioners are generally taught too, is that vitamin K is the blood coagulation nutrient that helps our blood clot.
Mm-hmm.
And so that's actually a molecule called vitamin K1. But there's another set of molecules, and this was discovered by Weston A. Price, and he actually, who was a dentist in the 30s, and he actually never found out what vitamin K2 was, but he wrote about this activator that did all these things in the body. This is what my book goes into. But what we've since found out is that vitamin K2 is a very different set of nutrients, and that's why you don't really see it in conventional dietary guidelines. I think it was 2006 that the levels for vitamin K2 were adjusted slightly. But what K2 does is it's a calcium management fat-soluble vitamin. So it's a fat-soluble vitamin, just like vitamin D, vitamin A, vitamin E is another one. But the really important ones, and the reason why fat-soluble vitamins are so critical is because they manage calcium. And so calcium is critical because it's what creates strong bones, strong teeth, but then they also direct your immune system. And so vitamin D will help you to absorb calcium. Vitamin K2 activates the proteins that go and put calcium and carry it physically into your bones and teeth. So without K2, you can't mineralize your bones and teeth. And so we have this problem. Probably one of the easiest ways to check for K2, in my opinion, is that spot that you get cleaned at the dentist down below your lower front teeth, where you get calculus buildup. So people that have calculus buildup and fast, thick calculus buildup, which is calcified plaque, often that's a sign that you don't have enough vitamin K2, and because plaque shouldn't calcify in large quantities, your plaque has a biological purpose, and so people that have this very fast buildup and this thick calcified buildup, it becomes it's often, if you take a K2 supplement, we can get this under control. So K2, critically important for strong bones and teeth, your immune system, the gut, the brain. It's an antioxidant in the brain. The kind of broader point here is that fat soluble vitamins are so critical and fundamental to your body. Everyone should be focusing on them, and we really do kind of learn from our teeth.
Yes, absolutely. Speaking about plaques in the teeth, what do you think about regular cleanings then?
Yeah, so look, our modern dental tools are kind of a great addition to our arsenal. For to keep a close eye on our oral environment. But the only thing I'll say about kind of hygiene and mouthwashes and disinfection of the mouth is that it doesn't really take into the broader context of how much ability our body and mouth has to heal itself. And really, if you have dental diseases, tooth decay, gum disease, it's a sign that you're not feeding your body the right thing. So I really, dental cleans are fine as long as we put them into perspective of how important food is. And so that's, if you're not eating the right foods and you're, for instance, getting gum disease, if your gums are bleeding or you're getting tooth decay, that's a sign that your body is lacking nutrients. It's a sign that you need to reprogram how you eat. And so that's how I really try and present it to my patients as such, is that cleaning and disinfection, especially, we really need to put into context, because there's a deep connection there to the gut as well, and we're swallowing thousands of bacteria every second.
Yes, and so everyone should be on probiotics, or what are your thoughts about that?
Well, probiotics can play a role. There are oral probiotics that do seem to play a protective role against tooth decay, gum disease. Diet is your best probiotic. If you eat a lot of fiber, you eat a lot of prebiotics, you eat a lot of fermented foods, you're going to get all the bacteria you need. However, in dysfunction, if you do have gum disease, if you have receding gums, bleeding gums, bad breath, these are signs of oral dysbiosis. So we do have thousands of bacteria in the mouth as well that connect to this all-important gut. And so I think that there are roles of probiotics. And so, for instance, people with sleep disorders, just going back to what we were talking about at the start, they often have gut disorders, and will also usually find some sort of sign of disharmony in the mouth too. So probiotics in those situations can be quite good to reset the mouth, the gut, and get that vagus nerve working as we want it to. So yeah, there's certainly clinical applications of probiotics. I think that people overall should be thinking about food, though, as their probiotic, 3 times a day.
Got it. And so receding gums, I always thought were just from maybe brushing too hard. Does that play a role at all in receding of gums, or is it really all based on the dysbiosis of the mouth?
There's different reasons for receding gums. So if you can have traumatic recession of the gums where brushing and with a hard brush, for instance, so that's, you can scrub away your gums. So you need to be careful with your oral hygiene regime in terms of that. But if the gums generally are receding without oral. So, for instance, between the teeth, and if you go to the dentist and you get X-rays and they say that your gums are receding, you need to be thinking about your gut, because your mouth is this interface between bugs, the oral microbiome, and the immune system. And so if your gums are receding, it's a sign that there's inflammation that's basically eating away the tissues of the gums. And so that's like a collagen based material that really shows that you probably have an issue with the gut, because your immune system, 80% of it is seated in the gut, and it's really a communication between your mouth and your gut. So you should never be thinking about your mouth in isolation. You should be thinking, I need to kind of find out what's missing in my diet that's making my gut unhappy, and then go down the road, potentially to further investigations.
Okay. All right, cool. And since we're on the topic of nutrition, are there certain foods that people maybe, aside from like sugar or corn syrup, that they should definitely stay away from to kind of help with teeth health, mouth health?
Yeah, so one big one is white flour. It's metabolized very similarly to sugar in the body. So I think people kind of, they might tend to reduce sugar in their diet, but you still could be getting a lot of simple carbohydrates that cause the same dysbiosis and the same metabolic effect as sugar. So I would be reducing your white flour in terms of your baked treats, your white breads, your pasta, just for the interim where you're going on a healing regime. And the big one I would really recommend is vegetable oils. And in the US, you guys have vegetable oils in nearly everything. But the reason why they are potentially harmful for your teeth is because when you're eating refined vegetable oils like canolas, sunflowers, soybean oils, these are what your body packages to carry around fat-soluble nutrients. So your blood lipoproteins, or your blood cholesterols as we know them, they are packaged up to send around fat-soluble nutrients in your gut, and that goes around your body from there in your bloodstream. Now, if you eat refined vegetable oils, it can create an unfamiliar and unstable environment for your blood cholesterols and fat-soluble nutrients to be carried around. And so this really, can be causing this inflammatory profile that we see, that they now kind of understand inflammation of blood vessels and arteries, for instance, being these lipoproteins and blood cholesterols that really aren't natural. And so natural fats, so getting away from those refined yellow bottles of oil that we see on the counter, and getting back to your butters, your ghees, your even your animal fats, your tallows and lards, coconut oil, extra virgin olive oil. These are the fats that your bodies are designed to recognize, and that's what will help you absorb all these important nutrients.
Okay. Oh yeah, one thing I wanted to ask when we were going back to the cleaning part, is there like a protocol that before someone goes to get a cleaning that they should be doing? Just because once you start to really scrape, sometimes the gums will bleed during a cleaning, and they're really scraping down into the gum line, which is all really going into your blood and potentially into your heart. So is there a protocol that you advise people to do before cleaning or right after a cleaning?
Look, generally, I would, you would want them to be, as I really try and get people, I find the fat soluble nutrients are the most important for their immune system. So I find people with inflamed gums are usually low on vitamin D. So we start them on a regime of vitamin D, and that helps to kind of kick your immune system into place. You're right. When we kind of do a dental clean, we will remove a dispersed community of bacteria. You have to put it into context as well, as that there are trillions of bacteria in our mouth and gut as well. And so, of course, we're exposing ourselves to a finite amount. If we kind of, pick up for instance, our immune system, which I really think vitamin D, vitamin K2, magnesium is really important. Zinc is important as well. So if you do have receding gums or gum disease, you'll be thinking about getting some of these nutrients and then going down your periodontal treatment road. And so some people will need this periodontal treatment to kind of reprogram their oral environment. But as you say, we should be thinking about how the rest of the body is healing as well. And you should never be treating the gums in isolation anyway, because they are a sign of the rest of the body, wholesale anyway. So if that makes sense, that you should be thinking about how your immune system as a whole is moving forward. So vitamin D, vitamin K2, vitamin A as well, obviously. So cod liver oil, zinc, magnesium, all really important in getting the immune system back in shape.
Okay, great. So they should be taking these things prior to a cleaning. I get concerned sometimes when someone is going through a chronic illness and they need to have some kind of tooth issue. The tooth issue is happening, which not surprising, and when to actually have them go ahead with getting any sort of procedures done, knowing the delicacy of all of the bacteria and potential dysbiosis that's just sort of being released into the body during such events. So is there anything that you can, as long as we're taking these supplements, that we should be good? Or is there like a rinse beforehand or after, or I don't know, vitamin, like not a glutathione, like a vitamin C push, or anything that would sort of help someone with this influx of bacteria that potentially could happen after a procedure or a cleaning even?
A vitamin, yeah, I think that it's a really good point. Anyone with a chronic disease should be moving forward with great care, and you should be taking the whole body into consideration before any kind of dental treatment at all. So vitamin C there could be benefits for vitamin C. I haven't used, I've really focused. I really try and find especially in the book, I do focus on fat solubles, because I find that once the body is set in fat solubles, I find that it does manage these water solubles if we're eating the right things as well. But I think potentially for someone that has a chronic digestive or metabolic condition, there could be deficiencies, and vitamin C, for instance, could be useful in that case. Yeah, I would be considering that.
Okay, great. And I always see these graphs, these diagrams of the teeth and how it correlates to organ systems in the body. Do you do that in your practice? Do you kind of see what tooth may be bothering someone and what organ may be related to that?
You know what? I'm really interested in those graphs, but I've not seen a lot of kind of scientific connection yet as to how.
It's good to know.
But you know what? I think where we're at. I think those connections are there, but we just haven't had the exact scientific kind of play out to really understand it yet. I don't think so. There's a lot of rationale to that, and so for instance, where we're kind of at is that the trials are starting to show us that for every tooth that we have, we lose a certain amount of airway volume, which is obvious when you think about it. But they're really, we haven't gone into that detail, and I'm really actually quite interested as to kind of delve a bit deeper into that. I'm actually looking at my next book, and this is kind of the area that I'm looking into that goes a bit little bit more into kind of Eastern medicine and how that crosses over, because there is certainly a rationale that Eastern practitioners use, per tooth, and how it connects to organ systems. So that's something that I think that I am very kind of I like to be based in, what I know is fact, and I do like modern research in terms of that. But I really think that there is something there that's going to be quite powerful, hopefully in the future.
Yeah. Great. Great. Let's see. And so was there anything about, how about, I see people with autoimmunity a lot, and there's a lot of research that says that amalgams, which contain mercury, can potentially cause people to have either thyroid problems, thyroid immune issues, autoimmunity, high mercury levels. And I don't necessarily encourage my patients who are not doing well, if they're in a flare or something like that, to be considering removal of amalgams at that time. I think the body's too fragile to be able to withstand that. What are your thoughts around that, around amalgam removals?
I think anyone in that situation where you have either autoimmune or thyroid problems, you really, if you go through these fundamental checks of the body, you'll be seeing that there is, potentially underlying problems in the gut, and that will often kind of show itself in the mouth in terms of bleeding gums, periodontal disease. Periodontal disease in itself really, it's quite interesting. It really is an autoimmune condition. It comes alongside a lot of autoimmune conditions like we have Sjogren's disease, oral lichen, so you have the white fluffy lesions in the mouth, and so when we kind of disconnect, people suffering these conditions, we're really trying to dig down into why it's happening, right? And so people can kind of focus on amalgams. I think that heavy metal toxicity. So the problem with potentially dental amalgams is that your body isn't able to process the mercury that's having to deal with those fillings in your teeth. And so we really should be looking to get your gut, your immune system in line. So all of those fat soluble nutrients we talked about, and really probably going a lot further as to a healing protocol that a lot of these people need to get the gut right, the thyroid. And then, once we're in a bit of a better spot, potentially you can test for mercury and other heavy metals. And so you want to know what your levels are at. And then once I like your approach in terms of getting the disease under control, then looking at potentially removal. And so I don't, I see people, functioning fine with amalgams. And so I don't think it's everyone needs them removed all the time.
Mm-hmm.
But if there are autoimmune conditions, there are gut issues, there are thyroid issues, you should certainly be thinking about it, because there's something your body isn't dealing with in its environment. And so, we need to be considering that. So the safe removal of amalgam, so with isolation and high volume removals of the materials, and then a good supplement program to make sure your body is detoxing itself as well.
Great. And there was something you mentioned a little bit before about gum disease. Let's talk a little bit about gum disease and how it relates to heart disease.
Yeah, absolutely. So the gum disease, heart disease, it's really been kind of interesting, how because that's been a big connection. I was taught in dental school that there is this connection between gum disease and heart disease. And the one that you talked about, where we remove the reason why dentists are worried about it, because they clean the teeth and people go off and have an infective acute endocarditis. That's kind of how we've seen the periodontal heart disease link. But we now I think we're getting a little bit deeper into understanding the links, because we now know, for instance, inflammation is very important in heart disease. And so when your arteries are inflamed, that puts you at higher risk of the conditions associated with cardiovascular disease. And so gum disease, we really spot these inflammations. So if the body is inflamed in the mouth, if your plaque and biofilm in the mouth isn't coping, it's a reflection of what's happening in the rest of the body. So the connection, between people with gum disease in terms of an inflammatory model and the baldonine, are you familiar with them? The cardiologist that wrote a book called the Baldonine Method, and they really talk about these checks to go through. And periodontal disease is nearly at the top of their list. And another one of their checks is infected root-treated teeth as well. So infections in the mouth, really, there's a lot of research out there to show that it puts you at high risk, or some of the highest categories of risk for cardiovascular disease because of this inflammation model. But the big one I think we need to see as well is the calcification, the management of calcium, because one of the most important measures for arterial health is the coronary calcium score. And so that's where they take a scan of your vessels and they'll check how much calcium, mineralized calcium, is building up in the vessels.
Mm-hmm.
And that, by definition, we know is a function of how much K2 your body has, because of the protein that K2 activates to pick up and take this calcium out of your vessels. That's what K2 is designed to do: take the calcium out of your vessels and into your bones and teeth. So the inflammation and lack of K2 and modulation of calcium in the body really is a much better model for how we see, for instance, how periodontal disease plays out. But the same processes are going on in the body, and that can lead to cardiovascular disease. So I think we need to see it as one continuum of problems rather than two separate entities, as like conventional medicine really, unfortunately, gets stuck doing.
Yeah, totally. And what about for all the parents who are listening now, if their children gets pretty frequent cavities, what is that a true sign of that we're just missing?
So the first thing you would be doing is checking their vitamin D, like absolutely religiously. You can do it with finger pricks testing in the US. I would be doing that every 4 times a year at a minimum. So we need to get their vitamin D levels up. The reason is that there are cells inside your children's teeth and your own teeth that are designed to both protect and repair teeth against tooth decay. So there's an immune system inside your teeth. They're called odontoblasts. They're the same cells that come from your bone stem cells. And what they do is that your body will actually turn the stem cells into bone-making cells or immune cells. And so the ones inside your teeth are driven by the same factors that your bones are driven by, which is at the core vitamin D, vitamin A, vitamin K2. So vitamin D for kids that are getting a tooth decay, I test it with every child in my practice, but any kid that has tooth decay that comes in, they will often be insufficient in vitamin D.
Okay. And it's not so does sugar play a role? Is that also like a huge thing? Is it also dysbiosis also playing a role with that?
Absolutely. Sugar plays a huge role. We know that. And so when you look at the mouth, you have your teeth and the skeletal system, which is like kind of your body's defense system. But then you've got the bacteria, the oral environment, the oral microbiome, that is, and what the bacterial environment of the mouth should be protective. So when it's diverse enough, when it has the right species there that actually inhibit the type of bugs that cause decay. There are bugs in the mouth that inhibit the bugs that cause decay. When we have tooth decay, we have this imbalance and loss of diversity of the oral environment that then triggers off the potential cascade to tooth decay. So we should be thinking about, are we replenishing our children's mouth with probiotic species? That's by fermented foods. That's by reducing simple carbohydrates like sugar and white flour. And also vegetable oils too. And so when we're replacing these probiotic species, we are giving our child a natural protection to tooth decay. So we should be looking at diversifying their oral bacteria.
Okay, great. I love this. All right. Well, we're kind of coming down to the end of the show. Was there anything that we didn't talk about that you really feel is important that we need to know? Anything that you included in your book that we just haven't touched upon?
Yeah, I mean, like generally, the mouth is really a signpost for the whole body. I really think the model of eating that I try and get across to people, when you think about nutrition in terms of your mouth, all the processes and diseases we've talked about, they become very difficult when the body is kind of in the state of dysfunction. In the mouth, we really can catch things first. So I really kind of encourage people to think of it that way. And, when you think about the way you eat for your teeth, gums, and, how a child grows jaws, for instance, it becomes much simpler. And so we really understand what the body needs and how we can, really supply it, instead of, putting harmful things in as a result. And so, the connection between the oral microbiome and the gut microbiome, for instance, that's one that is intimately ongoing throughout the day. Replenishing fat-soluble nutrients for your skeletal system, for your teeth, for your hormonal signals. All of this, is your tools to prevent dental disease for your life, but then for your children as well. And so the mouth, even though we see it as separate, we should never be thinking that way. And I really try and reprogram that in the dental diet, and just to help us understand physiologically, the simple lessons that our teeth tell us.
Yeah. Great. And so how can people find you?
Yeah, so they can find me on my website, where we talk about a lot of functional dental topics like we have today, like at www.drstephenlin.com. That's Dr. Stephen with a V, Lin.com. And on Facebook and Instagram at Dr. Stephen Lin, where talk about a lot of food, oral health, functional dental medicine, and generally how our lifestyle affects our health.
Awesome. And so the book is out, and they can find it anywhere. It's everywhere. Amazon.
Yeah, the book's available on Amazon, at Barnes and Noble, and any other leading retailers.
Great. Is this your first book?
It is my first book. Yeah, it's
Congrats.
been quite a process.
Yeah.
Thanks very much. Yeah, I've really enjoyed it, but wow, it's a big process of book. But it's been really rewarding. I've enjoyed it a lot.
Fantastic. Well, thank you so much. This has really been such an eye-opening talk tonight, and it's just fascinating. I knew about some of these things, but definitely not all of them. So thank you for enlightening us with all of your wisdom. Congrats on the book. I wish you the best of luck, and we'll talk soon, and definitely stay connected on Instagram, because I'm definitely following you on that.
Yeah, absolutely. Thanks, Margaret. And thank you for all your good work too. It's really important people have this, kind of mode of finding out why, potentially their health isn't what it should be. And so those roads to healing are really important to people.
Thank you. I appreciate that. Well, I really hope you enjoyed this conversation between me and Dr. Lin. Go out, get his book, The Dental Diet, learn all about what you can do for the health of your teeth, your gums, because that plays a huge role in avoiding any chronic illnesses, heart disease, and so on. If you want to learn more about him, check out all the show notes. Head on over to margaretromero.com/episode 72. You can also catch him on Instagram at Dr. Stephen Lin. And pick up his book. It's going to at Amazon, Barnes and Nobles, and everywhere you find books. And if you're not following me on Instagram, head on over there. I'm at Margaret Romero, and you will find me on most days Insta storying. So catch me there. I'll see you all next week. Much love, big hugs. Bye for now.